Hi, today we are going to walk you through how to do skull positioning. So I'm with my patient Lisa here today. First position I'm going to take you through is the Towns view. So I kind of have things set up already. At this point in the program, you guys should know the basics. I do have my image receptor in the bucky. My tube is already detented. For the Towns view, I have a 30-degree caudad angle on. I'm at 40 inches. Okay, for skull work, we want to make sure we've removed the pillow from the table, so that's gone away. Lisa, I'm going to have you go ahead and lay down on the table on your back. Again, make sure you go through all the proper verifications with your patient. For changing instructions, it would be everything from the neck up off. So if they have any necklaces, earrings, hearing aids, those kind of things will show up and need to come out. Also, think about women and any hair clips. Also, if they're wearing a wig, those kind of things you need to be aware of. Okay, so that's just my reminder with my emesis basin. And okay, so if collimated, we're going to be about a 10 by 12. Okay, and with ladies, when you're positioning them, just because they have a lot of hair, make sure everything is kind of tucked in and you can see around their head. For skull work, we need to make sure the whole top of the skull is on. Remember, it goes down past the base of the ear is the base of the skull as well, so make sure that is on there as well. For positioning, you're going to be 2 inches above the glabella, so really it comes in at hairline. Okay. Also, we need to have her tuck her chin. The OML line needs to be perpendicular to your table. Okay, so if your patient gets a really good tuck on their chin, they'll be in good position. I'm just going to check that. And Lisa, can you tuck your chin down as much as you can? Again, we're looking for that OML line to be perpendicular. Okay, I'm just pushing my bucky in. I'm going to use the right marker just because it's convenient, and I'm going to collimate in just a little bit. Again, I have light over the top of her head. She looks like she's in a really good position. Also, if she's not in good position, we can tuck a little positioning sponge under the back of her head, and it helps bring the OML line perpendicular. And she is just slightly off center. So I'm just going to move it over so it's midline down her face. We would set our technique, and that is our first image. So the second position that we are going to go through for skull work or skull positioning is going to be our PA. So at this point, you're going to have your patient turn onto their stomach. You'll also notice I've taken off the angle on our tube, so we are just coming in perpendicular. I've lined it up with our bucky. The patient, when they are lying on their stomach, we are going to have them bring their forehead and nose in contact with the table. Also, I just want to mention when we are moving the table that it is loud. So be very careful because the patient's ears are there, especially coming up in the next one you will also see. So be very kind to your patient and how much noise you make with moving the table and locking it. Okay, so for this one, forehead and nose, I'm going to be centering right through the nasion. Okay, so nasion is lower than the glabella. It's really at the top of the bridge of the nose. Patient is going to be straight. Again, you should see light all the way around their head. Again, can be tough with patients with longer hair. If you want, you can just open it up just a hair more. For my marker, I'm going to be putting it down out of the way. They flipped over, so I went for my right marker on the Towns. Now I'm using my left marker on the PA here. At this point, she's positioned well and we are ready to take our image. So go ahead and set your technique and take your exposure. The last view in this series is going to be the lateral of the skull. Right now your patient ended prone. They're facing the table. Easiest one for this, you could do either lateral, but since I want the person looking towards me, especially if either side doesn't matter, we're gonna have Lisa go and move into a right lateral, okay? So to do this, her body is still facing the board or the table. We're gonna have her bend up her arm and bend up her knee. So she's in Sims position right now. Her face is now looking towards the wall. You need to bend down and make sure her inner pupillary line is perpendicular with the table. Okay, so if she's looking down a little bit, we're gonna adjust the chin, yep. And sometimes just having them either move their shoulder or hip to turn the body helps them get in a better lateral. But again, don't be scared to get down and look right in front of them, okay, to make sure they're in that really nice lateral. Again, be careful because you want to switch your marker, and we also have to switch our collimation. Okay, so we're going more lengthwise here. Again, because their ear is on the table, just give them a warning that you're gonna move the table because it is very loud. They may want to lift up their head. So Lisa, I'm gonna move the table if you want. Pick up your head just a little bit. Also, I'm gonna move Lisa's hair. So for this one, we should be going 10 by 12 lengthwise. Excuse me, crosswise. I'm gonna put my right marker in there. So for my light centering point, and actually I'm a little high, so I'm gonna move it down. You should be 2 inches above the EAM, which is her ear. 2 inches above, we're gonna be pretty much right at the top of the actual flap of the ear, okay? I have to make sure I have light all the way around Lisa's head. So again, can be tough with a lot of hair, and also light in the backside. We don't need her whole chin. That's actually part of the facial bones. So we're gonna leave that alone, and we're all set for our position. Again, we would set our technique and take our exposure.